Welcome to the Radiology Vault, an open repository for radiology educational content designed for learners and medical professionals. Presented by the Michigan Medicine Department of Radiology.
Hello, I'm Dr. Malhotra, and this is my presentation on teaching the next generation of radiology advocates. I have no disclosures. My involvement in organized medicine began early in my medical school career and continued throughout residency, fellowship, and as an attending, but it's never too early or too late to begin your involvement in organized medicine. It's just simply important to give your time wherever you can, whether it's at the local, state, or national level. What is advocacy? Advocacy is the act or process of supporting a cause or a proposal. As we know, the practice of medicine is heavily influenced by legislation and court rulings, and we can't afford to stay uninvolved in policymaking and advocacy. We have power and influence in numbers, and this is through these organized medicine organizations. And people who are in all practice settings, whether it's academics, hybrid, or private practice, can benefit from involvement in organized medicine. So the reason we advocate for our patients and for the viability of our profession. Some of the ways we advocate include involvement in these organized medicine organizations, in local medical societies, health systems, institutions, and in private practice, and by meeting with your legislators on every level. And lastly, through any kind of media opportunities to educate the public or our patients. On the national level, the organizations that we think about are the American College of Radiology and the American Medical Association. And these organizations allow individual members to submit policy ideas to their state and specialty society. And if approved, and has a national scope, this can get forwarded to the AMA House of Delegates, where the policy is debated, and the policy is then voted on by the House of Delegates to become official policy. These policies help serve as the directive for the AMA to take actions and direct the lobbying activities. A lot of people ask, what if I don't agree with everything that an organization does or believes in? And I'm here to say that I think there's really never going to be an organization that you 100% agree with. However, that doesn't mean that you don't stay involved. These organizations are democratic, and they allow you to listen to one another and make yourself and make others more educated about an idea or a policy. And realistically, we're doing more harm to ourselves and to our profession by not joining, because we're leaving other people to make decisions for us, and we're not united in our efforts. Other ways that we benefit are by coordinating advocacy days and being notified of legislative initiatives to support through these organizations. So it's important to join and voice your opinion, create alliances, vote, and allow ourselves to educate each other and talk to our legislators. One of the other important functions of the AMA is involved in the reimbursement system. So the CPT codes, which lead to RVUs, which then lead to a payment for services provided. The current procedural terminology editorial board is actually housed within the AMA, and it's what decides what medical services can be billed and get CPT codes. So these specialty societies that are part of the CPT board get their representation by being part of the AMA. Similarly, the RVS Update Committee, or the RUC, which assigns an RVU value for each of these CPT codes, is also part of the AMA. We have representatives from all the major national specialty organizations. We're fortunate that the chair, Dr. Silva, is actually a radiologist, interventional radiologist, and we have 2 ACR representatives on the RUC. So it's very good to have representatives that can voice our concerns when it comes to the topics of reimbursement. In addition to this, so physician reimbursement is often the target of governmental budgetary cuts. We've seen a 2.93% cut for 2025. This is the fifth year for consecutive cuts. And when you take into account that in the past, we've had multiple cuts with inflation adjusted, that's a 33% cut over time. So while physicians have seen a 7% increase in the overall reimbursement, with the practice costs that have gone up 59%, it's really a severe cut overall. And why is this bad? It's because we are now having issues keeping our doors open, and practices are having a tough time being able to provide care in this climate where we're all competing to be able to provide services at a cost that keeps the doors open. When you think about the RVU system, it's basically a finite pie that has actually shrunk over time. And whenever you add services, it just kind of makes more cuts to the pie. So realistically, there's going to be winners and losers with changes in RVU evaluation and with bundling of services. So how do you get representation in the AMA, either on the state or specialty level? This involves being members of the AMA. So for a specialty organization to qualify for a House of Delegates seat, you have to have a certain percentage of your members be members of the AMA, or have at least 100 or at least 1,000 members, either or. So we're fortunate that we have several radiology organizations that have representation. However, there are still some radiology subspecialties that do not have representation. So we could potentially grow our influence if they were to have enough membership and see the value in applying for a House of Delegates seat. The ACR is a major radiology organization dedicated to radiology advocacy. They oftentimes will notify members of legislative initiatives. They have an annual advocacy day at the annual meeting. And then, as was shown before, they're involved with the reimbursement. They're also involved with creating the appropriate use criteria and clinical decision support, which is our answer to getting rid of prior authorization using data and appropriate studies to determine what should and shouldn't be ordered. And then lastly, they also have RadPAC, which is our PAC to help fund the radiology specific issues. On the state and local societies, we have, for example, in Michigan, the Michigan Radiology Society and the Michigan State Medical Society. So in the kind of hierarchy of this, we have the AMA at the top, and then we have, the radiology branch where we've got the ACR on the national level, and then Michigan Radiology Society on the state level, and then in the state society, the state medical society, and then the county medical societies. So at the state level, we have advocacy for legislation and policies that are particular to the states. Our lobbyists have close relationships with our senators and House of Representatives. Again, we're notified of legislative initiatives, and we have our own State Medical Society House of Delegates that mirrors the HOD at the AMA level. And then there's also the state PACs. And at the local level, you have a wide variety of ways that you can be involved. You can be involved in the hospital, the practice setting, the health network, or the health system. So it's important to be involved at every level, any level that you find, of interest to you. There's several committees that could use imaging experts. The standards and credentialing also could use imaging experts. And it's important to include our trainees in this process so that they understand where they can get involved. The power of the physician voice in explaining the issues to our legislatures cannot be underestimated. With our extensive training and our broad width and depth of knowledge, we're able to see firsthand the challenges that our patients face, and we're still the most trusted profession. For example, Dr. Mona Hanna-Attisha was the pediatrician that exposed the lead water crisis in Flint. It's important to remember that advocacy is a long game. You should expect opposition and try to work with other physicians to move policies forward and try to educate the legislature in a way that uses patient stories to get them to make changes. I'll end by talking about ways to interact with your legislators, which includes signing up for advocacy hill days that are sponsored by your state or national organized medicine society. It's important to read up on the talking points, wear your white coat, use your patient stories to connect with the asks, and realize that you're offering a source of information and expertise that they may not have. You can invite them to tour your facility and build an ongoing relationship, and then thank them for any support that they've had in the past for your issues. It's also important to email and call about any issues that come through call to actions. It's also important to note that PAC contributions allow our organizations to have a seat at the table. And this is a result of the court case Citizens United versus Federal Election Commission. So we're competing with other organizations with deep pockets. And so this funding is separate from the membership organization dues that you pay. I'll end by saying that there are ways that your residents and fellows can be involved. You can reach out to your advocacy leaders for resources, consider developing an advocacy or government relations tracks for the residency, encourage your residents to apply for positions through the ACR and their state radiology societies or medical societies, and give them the time to pursue these interests. Lastly, these are a couple of my references. Thank you so much for your time.